Pregnant women should be extremely cautious about taking medications, even those long considered safe. A new study from the University of Washington has found a troubling link between paracetamol, also known as acetaminophen, and the risk of attention deficit/hyperactivity disorder, ADHD, in children. This research, which analyzed blood samples from over 300 pregnant women, suggests that children exposed to the drug in the womb may have a significantly higher chance of developing ADHD by the time they reach 8 to 10 years old. Given that millions of children worldwide are affected by ADHD and diagnoses are steadily increasing, these findings add to growing concerns that paracetamol use during pregnancy could have unintended and lasting consequences. The debate over whether paracetamol contributes to neurodevelopmental disorders has been ongoing for years, but previous studies have produced conflicting results. A 2019 study found a 20% higher risk of ADHD among children whose mothers took the drug during pregnancy, yet a larger analysis last year failed to establish a pattern between exposed and unexposed siblings. However, what makes this new study particularly alarming is that it did not rely on self-reported data, which can often be inaccurate. Instead, researchers directly measured acetaminophen levels in the mother's blood, making their findings more reliable than many past studies. If these results are confirmed by further research, they could challenge the long-standing assumption that paracetamol is completely safe for expectant mothers. Paracetamol is one of the most widely used painkillers in the world and is frequently recommended to pregnant women to relieve headaches, fevers, and other discomforts. Health organizations, including Pluckett in New Zealand, currently state that it can usually be safely used during pregnancy, but they also caution that women should consult a doctor before taking it and adhere strictly to dosage guidelines. The problem is that many expectant mothers may assume that because the drug is available over the counter and widely prescribed, there is no real risk. Yet, this latest study suggests that even normal use of paracetamol could have long-term effects on a child's brain development, which raises serious concerns about whether current medical advice needs to be reconsidered. If the link between paracetamol and ADHD is real, the implications are severe. ADHD is a lifelong condition that can make it difficult for children to concentrate, control impulses, and succeed in school and social settings. As the number of diagnoses continues to rise, scientists and parents alike are searching for answers about what could be contributing to the trend. If a common pain reliever is playing a role, health authorities need to take urgent action to reevaluate its safety for pregnant women. The fact that different studies have produced mixed results has allowed regulatory agencies to avoid making firm recommendations, but this uncertainty should not be an excuse for inaction. Pregnant women deserve full transparency about the risks they may be taking when they use any medication, no matter how common it is. The medical community cannot afford to dismiss these findings. While further research is needed to confirm the connection, the evidence is strong enough that expectant mothers should be given clearer warnings about the potential risks of taking paracetamol. Doctors need to be more cautious in recommending it, and women should explore non-drug alternatives for managing pain whenever possible. Until there is definitive proof that paracetamol is completely safe, the best course of action is to err on the side of caution. The long-term health of unborn children should never be compromised for short-term pain relief.